Shri Gourav Gogoi.
Thank you very much, Chairman Sir, for giving me the opportunity to speak on this very important subject. Sir, there was a time when healthcare was not available in remote parts of India, primarily because of poor connectivity, lack of roads, and not enough funds for creating hospitals. If people wanted good quality healthcare, they would have had to walk for kilometers, travel for days in order to reach even a place where there was a doctor available or someone who had a basic stethoscope. But a lot changed when, in the previous decade, the government of India launched the National Health Mission and the National Rural Health Mission. A lot of funds were pumped in through the National Rural Health Mission. And what this achieved was that it made healthcare accessible to a large parts of India's population. Because of the funds available through the National Rural Health Mission, hospitals, sub-centers, primary healthcare centers were being created in those villages and those areas in which they had never seen a hospital before. So I think that was one of the major achievements that our education policy did, was creating the health infrastructure. Now having built the hardware of hospitals, sub-centers, primary health centers, we must focus on the quality issue, the quality of healthcare. Often what is happening, sir, because there are too many patients lining up outside doctors, doctors are in a rush to prescribe antibiotics. They are within 2 minutes, without entering into a proper diagnosis, what the doctor says, oh, you have a headache, here's an antibiotic. As a result of which, what is happening is that the common infection, like a common viral fever, viral cold is developing this huge resistance to antibiotics. And now we have this phenomenon of superbugs. This is exceptionally dangerous. The corollary, the same is in agriculture. जब हम खेत करते हुए ज़्यादा हम दवाई डालते हैं, तो खेत में जो वो कीड़े लगते हैं, कीड़ों का जो resistance है वो बढ़ जाता है, and it takes that much more pesticides to kill the same pest. The same thing is happening around human systems, sir. Superbugs these days are becoming more and more dangerous. There's even a term called the New Delhi NDM, which is creating a very bad image in the World Health community. So I urge the Ministry of Health to look at this issue of superbugs, train the doctors, facilitate these doctors. This is becoming a risk that even a common cold can become fatal. But is the government doing enough? Is the government serious? A simple question is, sir, I remember reading a press headline when the ease of doing business ranking of India just improved by 1. You know, sir, the ease of doing business ranking is a huge priority for this government. So when, after so many initiatives, when India's ease of doing business ranking improved by 1, the PMO was so concerned that they organized a cabinet meeting, wrote letters and gave instructions to chief secretaries of all states. On the contrary, there's another ranking, sir. It's called the Global Hunger Index. In the Global Hunger Index, the ranking of India fell from 83 to 97. It fell by almost 14 spots. But was there a similar meeting? Was a cabinet meeting called? We have heard the statistics on malnutrition, that 50% of India's children are vulnerable to malnutrition. But has there ever been a cabinet meeting? The government is pays so much attention to the ease of doing business, but completely forgets about hunger and malnutrition. Another example, sir. Recently, we saw that in Gujarat, the maternal mortality rate rose from 72 to 85. Now, how did that happen? When we want to decrease maternal mortality, why in a developed state which has access to enough funds, why did the MMR increase from 72 to 85? Has there been an inquiry? Has there been a cabinet meeting? Not a word, not an instruction from this government which claims that health is a priority from them. If there is one example, sir, that I want the House attention to be drawn to, is the way the UPA government eradicated polio from our country. Polio was a debilitating disease. The way we eradicated polio is a lesson in healthcare, sir. Door-to-door movement of ASHA workers, door-to-door movement of community health workers. Polio drops need to be administered on a specific time schedule. The entire population of India had to be trained on this particular schedule. The government flooded with public health advertisements. That's the way. We need a movement. If you really want to improve the health scenario, a discussion in the parliament is very good. But if there is a lesson to be learned, there needs to be a healthcare movement like the way we did earlier when it comes to eradication of polio. Sir, right now we have to focus on our Anganwadi workers. They are our extension of government. They are the ones who are working in the field, delivering best practices and helping people understand about best health practices. We have to work with them. Anganwadi workers today are not getting sufficiently paid. Anganwadis and Asha workers today, when it comes to funds, the funds from center are being delayed. You must be having the same problem, sir. Anganwadi centers, when our children of poor families go to Anganwadi centers, the money that gets released for their food should be such that there should be enough money in one Anganwadi center to buy 100 days of food. But what is happening? For example, in my constituency, they have only enough money to buy 58 days. Sir, these are the most deprived families, most deprived communities. Why is there being such a delay in release of central funds? Why is there not better coordination between center and state so that Anganwadi workers not only have enough money to buy 100 days of food but have a surplus so that they are not so dependent upon the center? So I want to talk about malnutrition. It's as one of the, a report from the World Bank said, that malnutrition is a silent emergency. We must wake up to this problem, sir. Our children are going to schools, yes. There is midday meal, yes. But they're still suffering from malnutrition. As a result of which, they are falling sick. They're not paying attention in school. They are dropping out. Their attendance is suffering. There must be, I know various state governments are doing a lot. Maharashtra is doing a lot. Tamil Nadu is doing a lot. In Assam, in my constituency also, we're trying to do a lot. Many other states. So we must try to collect a database of what are the best practices that is being done across the states. For example, in my state, sir, we have come up with a nutrition toolkit. A toolkit which helps teachers explain best nutritional practices to the children. It's very simple, sir. The very same way we are using teachers to help educate children about hand washing, we can work with teachers to help educate parents and their children about better nutritional practices. And it's one of the simplest things, sir, is to eat green leafy vegetables. Eat green leafy vegetables which are indigenous, which don't have to be bought from a distant market, which are locally grown, locally procured. So in my constituency, what we are doing is, we are helping children in schools develop school nutrition gardens through creating organic farming clubs. These children are being taught how to grow green, leafy, local, indigenous varieties of vegetables on their school playground, and when they produce that amount, they are selling that amount to the midday meal, because the midday meal has to procure these vegetables, and then these vegetables are being consumed by the children as part of the midday meal program. It's a huge success. Children are learning the basics of organic farming, of healthy eating practices. They are able to identify which are the local varieties of vegetables, and by selling it to the local midday meal authorities, whatever money they earn it, they put it in their own individual account. What we have, for each student, we've opened a minor savings account. So when a child grows vegetables and sells it to the local midday meal authorities, the money that the child earns doesn't go to the parent or to the headmaster. It goes to his own minor savings account. So from a very young age of 13 years to 14 years, a child is learning the basics of agri-entrepreneurship. This is a very interesting model. A lot of states are experimenting with this school nutrition gardens. The UNICEF is working in Delhi as well. I urge the ministry to look at this concept. It requires a synergy between Women and Child, Ministry of Health and Ministry of Education and Ministry of Agriculture. But this is the way we need to work. We have to work in a series of convergence. I have gone through the basics of, through the summary of the new National Health Policy. It's difficult for me to understand what is the priority of this government. What is the one theme that this government is going to focus on? See, for instance, in education, it's very clear. In education over the last decade, the focus of education programs and projects was on access. So through SSA, through midday meal, the focus of previous governments was to make education accessible to a large population. Now, over the last couple of years, the focus of education is, now that schools have been set up, the focus is on quality of education, learning outcomes, making sure that students learn or are able to understand what is being taught in classroom. But when I look at the new or the draft national health policy, it seems to be a hash of what has already existed before. What is the core thrust area? It talks about setting various targets, but doesn't give a clear roadmap. So I want the national policy, the health policy, to have a clear thrust area. And tell us, how are we going to measure this? Sir, sorry, madam, I'm going to just come to the end. I think that what we need right now is a new idea towards healthcare. We've talked a lot, we've talked about, I don't think we should blame anyone. We should neither blame the doctor, the nurse, the people who don't have enough awareness. What really we need right now is political leadership. If every state chief minister, if every MP, every MLA, if not just the health minister, but the PMO and the Prime Minister himself makes healthcare a priority, gives it the requisite funds, and say that we're going to focus on the quality of healthcare, that is how we're going to achieve our SDGs. It is good to have this discussion, it sensitizes us, but we have to go back in the field. And I must say, through this discussion, I do hope that MMR, the way it has risen in Gujarat, gets reviewed. We hope to reverse the slide, not go from worse to even worse. And we must take lessons from the eradication of polio that was done under the UPA, and we must come out with more funds for National Rural Health Mission, not decrease funds. So with that, I end my speech over here. Thank you very much.